Hey everyone, it's Dr. Langford. I wanted to share a community health talk that I've given to numerous groups in the area, as well as nationwide, about overactive bladder issues, bowel issues, and stress incontinence. And I thought you might find it helpful. So, as long as I can share my screen here, I want to make sure that you guys have the information and we'll go through it just like you were at the talk yourself. Okay, everybody, it's Dr. Langford. I wanted to share with you a community health talk that I have given many times that I feel is a valuable set of information that can be used for a lot of people. I mean, the incidence of urinary incontinence and bladder issues can go as low as 1 in 3 and as high as 1 in 12, and that's pretty common. So I think getting some of this information would be helpful. So rather than having you come to me, I'm going to come to you with the information. So let me talk to you a little bit today about regaining control of your bladder and bowel. So these are just a few disclaimers regarding the Axonics system and Bulkamid, which you can read at your leisure. But I want to tell you a little bit about me. So I am a board certified urologist. I have been practicing and in the medical field for over 25 years. Have completed a fellowship in female urology and voiding dysfunction at the Cleveland Clinic in Florida. I'm a fellow of the American College of Osteopathic Surgeons, and I am a key opinion leader in the field of pelvic floor disorders. Currently, my practice is in Fort Myers, Florida, and I focus on female issues. However, I also deal with male incontinence, as this can be a really devastating problem for both men and women. And my whole goal in my practice is to improve people's quality of life. So, how can bladder symptoms really disrupt your life? So, a lot of people feel as though they have to constantly stop on trips. They might go to a theater and try and watch a movie or watch a show and have to get up and leave and disturb everybody while they're doing that. And they worry that they can't make it to the bathroom in time. And these are real quality of life killers. So, what you should know is that your condition isn't a normal part of aging at all. It's not a normal part of being a woman. It's not just a problem with the prostate, and it's not something that you caused or did. You did not cause this problem. However, you should know that if you have the problem, there is help available. So again, it's impacting your quality of life. It can be in many ways. If you are still working, it can cause absences from work, decrease your productivity. As far as psychological, it really makes a big difference. You can be embarrassed. You can feel like you have fear to go out and do things in a social setting. I have a number of patients that tell me that they have real fears of getting on a plane and being in the middle seat, not being able to get up and go to the bathroom, or going to their children's homes and staying overnight just in case that they have an accident in the bed and ruin the bedding. So it can be a real change in your lifestyle for the worse. And I definitely want to see that people at least acknowledge that this can be an issue and seek help to improve this. So physically, lots of people avoid exercise, which is unhealthy because they leak. And, it can affect your intimacy as well. I did a study one time when I was at the Cleveland Clinic showing that women were most bothered by the fact that they were worried they might leak during sexual activity. And this can clearly affect a couple's intimacy and something that can be very bothersome. So it's really important to know you are not alone. So, speaking about just stress incontinence itself, you need to know that it affects 1 in 3 women at some point in their lives. That is really prevalent. Anything that would affect 1 in 3 would be considered a health emergency. So, we really want to make sure that you're not in a situation where you're suffering with something unnecessarily. So, let's understand what your condition really is when we're dealing with stress urinary incontinence. So the way the bladder works is it's kind of like a water balloon. It fills up slowly with urine, and it should sit nice and quiet and calm and allow your bladder to fill calmly. And the internal urethral sphincter muscle should sit tight and closed and hold the urine in until such time as you are wanting to go to the bathroom. However, when you have increased physical activity like coughing, sneezing, laughing, exercise, anything that could increase your abdominal pressure. The common one I hear in my office is going from seated to standing. This puts pressure on the bladder and pushes the urine towards the urethra. And so generally the muscles will contract to hold the urine in. However, with stress incontinence, these muscles and the urethra or the tube it comes out of is just not strong enough to hold it. So you might end up leaking either a small amount with little drips, or it can be a huge amount, which is the entire bladder content. And this can be a really embarrassing situation. So the good news with this is that there are treatments for women that can really help. So you want to start with the simplest things and obviously figure out what the pattern of issues is as far as your urinary situation for you. However, you can start with pelvic floor exercises. Many women are aware of Kegel exercises, and these are super helpful. 85% of people that do pelvic floor Kegel exercises will have some improvement, but sometimes that's not enough. So if you need to have an intervention, there's a couple of different choices you have. One is the sling. A sling is a polypropylene mesh that is put under the urethra and helps to support that area so that you stop leaking when you cough and sneeze and do something physical. But in recent years, many people have had concerns about doing something more invasive like a sling because it involves a surgery and an incision. It also involves the polypropylene mesh. So a lot of women have chosen to pursue something like a urethral bulking. So, again, going over kind of just the simple things you can do on your own. There's lifestyle changes. Keeping your weight in a normal range is really important. Making sure that you quit smoking and control any chronic coughs. And then there's the pelvic floor exercises such as the Kegels or working with a pelvic floor physical therapist to strengthen those. They can always help, and I think they're a great adjunct. I recommend it for almost everyone in my office, but sometimes they're just not enough. So when it's not enough, again, we started to speak about the sling. So there's about an 80 to 90% success rate, and we have long-term follow-up saying that it's the gold standard for surgical intervention for stress incontinence. And as you can see by the little picture here, it's an actual mesh graft that goes underneath the urethra that's placed surgically, and it is something that is done quickly in an outpatient setting. It can be done in about 10 to 15 minutes. But there is some recovery with it, and the goal is to resupport the urethra. Now, a simpler way to deal with this, and something that I use as one of the first line therapies in my office, is something called Bulkamid, or using a urethral bulking agent. This is a just a simple plumping injection, just like women will get the plumping injection in their lips. This is something that goes around the tube that you urinate from, so around the urethra, and it's injected with a little scope where I take the scope, look in the bladder, and then pull it back to the urethra and inject four little cushions that tighten things up. So if your urethra is wide open like this, it plumps it up so it's a little tighter like this. The beauty of this is it just takes a few minutes. It can be done in the office or in the surgery center. It's extremely low risk and you get immediate results. So what is Bulkamid? It's a minimally invasive non-mesh alternative to treat stress urinary incontinence. It's a water-based gel. It does not cause inflammation or irritation at the area. It's very biocompatible, and it is used to improve or cure stress urinary incontinence. So how does Bulkamid work? So if you're uh, looking at the bladder and the urethra, what we do is take this small little telescope and put the gel into the urethra, as you can see in this little video. And we put it in four little cushions around the urethra, tightening up the valve. It is super simple and it's super safe. So when we do these implants, it remains in the body. But the important thing is it just really helps to close that sphincter. So if we have a plumbing problem where the valve is leaky, we're just making the valve tighter so it's no longer as leaky. Here's the real key. It's 92% safe and effective. So 92% of women reported being cured or improved following just in one injection with Bulkamid. It's a very simple procedure. It literally takes 10 to 15 minutes. It can be done under local anesthetic or it can be done with some sedation. And it is clinically proven to last for 7 years. Some of the data about slings indicate that they last around 10 years. So we're talking about something that's almost equivalent to a surgical repair and is much safer, much easier, and much more um, recommended by women that have had procedures like this. They prefer to do something that's simple, like an injection, rather than something that involves an incision and some downtime afterwards. So now I want to turn my attention to people that have overactive bladder, and this includes both men and women. As you may know, incontinence is not as simple as just leaking with coughing and sneezing. Sometimes it has to do with a real urgency to get to the bathroom, and that actually can have to do with both the bowel and the bladder. So here's some safety information just for your awareness. But it's really important for you to know that you're not alone if you have this problem. If you may have seen this commercial on TV, this is Jill. She's a real Axonics patient, and she actually was someone who had some incontinence issues and herself approached Axonics about being on the commercial because she felt so passionately that this was an important thing for women and men to both know that this is an option to help them. So know that overactive bladder is a common condition that happens in about 50 million people in the United States. And in addition to that, 19 million suffer from fecal incontinence. The real key to this, and the reason I'm even bringing this information to you, is that only half of these with severe symptoms will seek treatment. You need to know you're not alone. You need to know that there are options, and you need to bring this up to your doctor. We can do so much to help you with this. And now is a great time in the medical field because we have something that can help you with all of these symptoms. So, when we're talking about nerve stimulation and what kind of conditions it treats, you need to know that it actually helps to restore normal nerve function so it can help in all of these conditions. So, it can help with overactive bladder, and that's where you have the severe urge to urinate and an inability to hold and control it. It can help with urinary retention. So, kind of on the opposite spectrum, I tell my patients it's kind of like a pacemaker for the heart. So, if your heart were to go too fast or too slow, the way this works is similar for the bladder. So, if your bladder goes too fast, like an overactive bladder or urgency, or if it goes too slow, like with urinary retention, this can bring it to a more normal rhythm. Now, what's really interesting about this is it also works for fecal incontinence and fecal urgency. So, meaning when you have to run to the bathroom for a bowel movement and you can't make it in time, or you just have that severe urgency, this can make a huge difference because it works on the nerves as they come out from the spinal cord. And these nerves split off and go both to the bowel and the bladder. So, where this works actually accesses the control nerve fibers for both these issues. So, restoring normal function is what you need to know, and knowing that it can help with all these conditions is really important. So, what does normal bladder function require? It requires a normal storage of urine so that the bladder is very relaxed. The urethra and the muscles around it are tight, so it's holding the fluid in the bladder. And then when you want to go, you want to have the bladder contract and the urethra relax. So that's what normal bladders should do. So overactive bladder is when you have the frequent and urgent need to empty your bladder, and it can result in unintentional urine loss. So it's a fine line. We're really trying to get you to a situation where the bladder empties appropriately, but not inappropriately. Now, fecal incontinence is the uncontrolled loss of stool, and it can be solids, liquid, or mucus. And the symptoms occur usually with an urge to go, but it can also happen with passive incontinence and soiling, and this can be a devastating problem. So, what is normal bowel function? Normal bowel function works on pressure and stretch receptors in the rectum and the colon. And so, as the rectum fills, these receptors kind of send these signals back to your brain saying, hey, the bowel is full, we need to empty. And to defecate or to move your bowels, the nerve signals coordinate the relaxation of the pelvic floor muscles and push the muscles help the rectum to push the stool out. So, when this dysfunction occurs either in the bowel or the bladder, and the coordination of these normal functions of storage and evacuation are dysfunctional, what we need to do is work on re-coordinating them. So the good news is there are treatments to help regain control of the bladder and the bowel. So when you are coming to a point where you realize you have issues with this, there's a pathway we really want you to follow to kind of get control of this. And you always want to start by talking to your primary doctor. Always bring up things that are bothersome to you during that visit. I know many times you go in there and it's rushed and we're talking about blood pressure, you're talking about mammograms or just regular screening, but you need to talk about things that are related to your quality of life as well. So if your bowels or bladder are a problem, bring it up to your doctor. Most of the time, your primary care doctor can start you on the pathway with initial treatments. You can start doing a diary to keep track of what's happening. You can undergo certain testing. You might need a colonoscopy. But at least your doctor can talk to you about some of the initial things that you can do. But what I would encourage you to do is if you don't get relief from these simple things that your primary doctor recommends, follow up again and let them know that you're having trouble. We have advanced therapies that are available and they work so well. And I'd hate to see you miss out on these just because you didn't pursue it further. Remember, less than 50% of people with these severe symptoms seek treatment. So, with the common therapies that are available to people with overactive bladder now, one of the things you need to know is that 80% of people that are started on overactive bladder medications will discontinue these medications within a year. So, for whatever reason, if you feel like the medications have a lot of side effects, dry eyes, dry mouth, dementia, constipation, or if they have the side effect of being just too expensive, you need to know that there are other options. So, initial treatments with overactive bladder would include things that are simple, like the bladder training exercises, lifestyle changes, losing weight, trying some prescription medications. Initial treatments for urinary retention would be behavioral medications I'm sorry, behavioral management and alpha blockers like certain medications that men take for their enlarged prostate. For fecal incontinence, there's not very many initial options that we have, really. You're just going to do some physical therapy exercises, change your diet, and you might try some overactive, over-the-counter antidiarrheal medications. But they're just a little limited as to what we can do initially. So a lot of times people will give up. But what you need to know is that there are other things you can do. So as you can see on the line at the bottom where it talks about advanced therapies for overactive bladder, we've got sacral neuromodulation. This is the axonics I'm talking to you about. We have percutaneous tibial nerve stimulation. That's actually a little stimulator that can either be implanted or used externally on the nerve by your ankle, and it gives a feedback to the bladder to tell it to behave appropriately and cut down on the urgency. And then we even have injections we could do right into the muscle of the bladder called Botox. You may remember that from people putting it in their forehead, but we can use it in the bladder, and it has been used safely in the bladder for many, many years. And it can actually help to control overactive bladder. For urinary retention, you're a little limited as to what we can do to help you. Um, if we can do some kind of surgical intervention for the prostate, sometimes that can help. But sometimes men will have urinary retention even after we open up the prostate. Um, and there's situations where people will actually have to start to catheterize their bladder. And this can be very disrupting to a lifestyle. And it's sometimes physically hard for people to do for arthritis reasons or just being overweight or difficulty getting the catheter in or discomfort with putting the catheter in. So that's a little limited as to what the advanced therapies are. And then when you think about fecal incontinence, you're really in a situation where there's a surgical intervention that can be done, which has a very high failure rate. But across the board, what you need to know is across all of these problems, advanced therapies include sacral neuromodulation. So we can control what the bladder and bowel are doing by working on the nerves. And it is something that is safe and easy to do. So let me just tell you a little bit about the advanced therapies. Percutaneous tibial nerve stimulation, or PTNS, is done in the office and it delivers a little low-level electrical stimulation through a needle above the ankle. You come to the office about once a week for 12 weeks and we do about a 30-minute session. And you usually see some response in 5 to 6 sessions, but it's Medicare approved, it's indicated for this issue, but one of the issues is that you have to begin long-term maintenance. So you kind of have to come to the office and have this done frequently. So it involves a lot of visits to the doctor's office and a fair amount of time on your part. And it does not relieve things on a permanent basis. It just improves them as you maintain. And then we have the Botox injection. So botulinum toxin A is injected right into the muscles of the bladder and it helps to relax them. It's been found to be safe and effective. But one of the issues is that it has to be done every 6 months. So you have to get the procedure every 5 to 6 months. And 60% of people will discontinue Botox treatments. So remember, we talked about medication. 80% of people will discontinue medication, and 60% will discontinue Botox use. So we want something that's long lasting, easy to use, and something that you don't have to maintain so much. So that's where sacral neuromodulation comes in. This can be trialed in the office, and this is something I think is really important to understand. If you're nervous about doing something like placing a nerve stimulator, what you need to know is that you can try it before you buy it. You can actually try a test of this stimulation, which you can see being shown by the little schematic on the left there. We can do a test procedure. We use a little tiny wire about the size of angel hair pasta. I place it with a needle and local anesthetic in, it can be done either in the office or in the surgery center with little sedation. And then you actually go home and try it on your own. So before you do it, we do a bladder bowel diary to see where you are. And then after you do it, we do a bladder bowel diary. And what we're looking to see is that there's a 50% improvement, meaning that the nerves respond to the therapy. You try it for that period of time, and if you don't like it or you don't get the response you want, we just take the wires out and you're no different than you were before you started. There's no permanent issues with it. However, if you get that response and we see that you're improving, if you tell me, hey, this was the first night in years I slept through the night and didn't have to urinate, or we look at your bladder diaries and we say, okay, you went from 5 pads a day to 1 pad a day, we can see that there are subjective and objective improvements in this area. And when we notice that, we know that you're a good candidate for the full implant. So I think about this like a test drive. You're test driving the device, so you know how it feels and how you personally respond to it. So after a successful trial, most people choose to get the long-term solution, and this includes a really small, discrete implant. So again, these are two patients that have had Axonics therapy that have felt so passionately about it that they have actually been a part of the ad campaign for Axonics to share the information so people know what's available. So let's talk a little more about what Axonics therapy actually is. It's a sacral neuromodulation therapy, which is a big word, that is guideline recommended to restore normal control of the bladder and bowel. So this means that the higher ups in the institutions that help to make our guidelines on how we should treat people with overactive bladder, urinary incontinence, urinary retention, fecal incontinence, fecal urgency, have all recommended this as a therapy for patients that have either tried medications and failed, have been intolerant of medications, have had a full evaluation and just haven't improved, or they just contribute to shared decision making in the office with their doctor and say, "This is what I want to do to have long-lasting results." So it's indicated in patients for the things we talked about for urinary incontinence, for urinary retention, and fecal incontinence. And the way it works is working on some possible abnormal communication between the bladder and brain and the bowel. So what we're talking about is the messaging system, the wiring going from the brain to the bowel and the bladder. So what we're looking to do is restore this communication. Somewhere along the line, your bladder and bowel have decided to say, "Hey, we have a problem, we need to go." And the brain is unable to control it. So what we're trying to do is simply get your bowel and bladder back on track. What Axonics does is gently stimulate this nerve to restore this normal communication and improve the symptoms. So again, talking about the test that's right for you, in my office, I'll place the wires on a Monday. I'll have the patients come in on a Friday. They keep the wires dry and clean, so that that's really the only limitation after we do the testing. And what we really want them to do is kind of go about their normal activities, so we can test to see if it really improves their symptoms or not. One of the really awesome things about Axonics and the innovation that's available through Axonics and their parent company, Boston Scientific, is that they have really taken sacral neuromodulation, which has been available for quite a few years, and perfected it in a way that it is really simple for both you as the patient and me as the doctor to manage. It has two options. You can use a small rechargeable device that provides therapy for 20 years or more. Think about that. A therapy that can be used for 20 years is pretty astonishing. Very few things in medicine last that long and work that well. And this is something that can be recharged about every 6 to 10 months, depending on the use. And we use this little tiny patient controller to turn it up, down, on, off, or allow them to get an MRI. Now, if you choose to do the one that is charge free, this device is just slightly larger and it lasts for 10 to 20 years. Again, it's small, it's thin, it goes right under the buttock cheek, and it is really something that if they could make a cell phone like this, everybody would buy one tomorrow. It really is simple to use and something that you can almost set and forget. So, as far as what part of it the patient has to play, once I put the implant in, I program it to the settings that I feel are right for you. And if that's all you need to do, you can leave it alone for 15 to 20 years and never deal with it again. Hopefully, not thinking about your bladder or bowel problems. But if by chance you needed to do something or to change something, it does have a tiny little patient remote control. This patient remote control looks like a key fob to a car, so it's not something that's obvious to anybody that you have it. It's not something you have to carry around or even use at all. It doesn't require that you push it to urinate or move your bowels. You really just leave it alone. But if by chance we want to adjust your device a little bit, we can turn it up or down. And it's a way that we're able to, in the office, adjust your therapy in case we need to kind of fine tune it a little bit. I tell people that it's like turning on the TV. You turn on the TV and you have a number of channels to watch. And I might think you want to watch the History Channel, but you might want to watch, let's say, true crime. So when I see what your response is, we just change the channel. This is your remote control to help change the channel to get better therapy for you and suit it, uh, uh, customize it just to your issues and your problems and your results. Here's the other thing that's pretty astonishing. You can now have full body MRIs with this device. It does not preclude you from having any testing. So if by chance you have a back issue and you need an MRI of your back, or you end up falling or having a car accident, this is something that will not make it limit your imaging issues, which is very important, specifically in patients that have neurologic conditions or other issues. MRI access is super important and is something that's available with this device. So, what are the results? What does it actually do? It creates meaningful and lasting improvement. So, 93% of people that have the Axonics device reported clinically significant improvements in incontinence symptoms at 2 years. So that means it's a huge number of people, a really high percentage of success, and it's still lasting at 2 years even. So we know that we people are happy with it, and we know that people are doing well with it even longer term. So, again, as mentioned in that study that was published, 2 years after the implant, over 90% of patients were satisfied with their results, and 94% of patients, so over 90% were satisfied, but 94% were satisfied with the Axonics therapy. And then if you think about it, what's really important is that 93% of patients would undergo the therapy again and expect the same results. So that tells you that this works, it lasts, and people are happy with it. And this is again a real patient that really just points out that it's fantastic for her to live a normal life again. It's all about your quality of life. It's all about having control over your bowels and bladder and just being able to forget about them, quite honestly. So, what is the next step? The next step is to really reach out to your doctor. I obviously treat people with this in my office all the time, but the fact of the matter is, you may not be close to me, you may not be able to get to me, but there are thousands of doctors in the all across America that offer these therapies, and I would encourage you to both talk to your primary care physician and talk to really any healthcare provider that can guide you to get to where you can get better results. This is a real improvement in the way we treat overactive bladder, urinary retention, and fecal incontinence, as well as stress incontinence. These are simple solutions, these are long lasting, and I cannot encourage you enough to reach out and get help. So I hope this was informative for you, and I hope you have a great day, and I hope you work on improving your health.